Hi everyone, I'm sure by now you've heard of the coronavirus or COVID-19, but today I want to talk to you about why it is so important to follow the CDC's recommendations for self-isolation and shelter-in-place to slow the spread of the coronavirus. The virus is believed to have originated in China, and while they're not completely sure how it began, there's a lot of scientific evidence that points to it being a virus that mutated from bats and it mutated to jump from bats to humans. The symptoms of the disease, the early symptoms is low-grade fever, dry cough, fatigue, and as it progresses, it sort of affects your lungs as like pneumonia would. You begin to have trouble breathing, shortness of breath, chest pains, and it can be fatal for some people if you don't get medical treatment. The disease is transmitted through person-to-person contact. Respiratory droplets such as coughing and sneezing that get spread through the air or skin-to-skin contact. That's a lot of the reason why self-isolation is such an important step for slowing the spread of this disease. One of the reasons that it is so dangerous is through its person-to-person contact, it spreads very quickly. It is a very aggressive virus that has swept across the globe at an amazing speed. As of April 1st, there are about 860,000 cases worldwide, 188,000 in the US, and a total of 42,000 deaths worldwide. And that number just keeps rising every day. And every day that we don't practice self-isolation and shelter in place, it's just increasing the number the next day. The most people that are at risk as far as fatalities for this disease are the elderly, people with compromised immune systems, or those with underlying lung issues such as asthma. Another effect of this disease on our community is the overload on our healthcare system. With such a surge of patients coming in for treatment, we simply don't have enough hospital beds, enough staff, enough supplies, and with this disease and its lung issues, ventilators are a very important medical equipment needed that we simply don't have enough of. And the CDC's recommendations for self-isolation and shelter in place, a lot of that is to help flatten the curve. And what that means is, with the disease, if it goes unchecked with no safety measures, it will skyrocket really up before it peaks and then come back down. But our healthcare capacity is right here. When we get up here, that's whenever our hospitals get overloaded, our doctors get overloaded, our supplies are depleted. And it could cause people to not get the healthcare that they need, and that's not a good thing. So by flattening the curve, by self-isolating, by sheltering in place, we're slowing the rate that we go up so that we peak at a lower point, and we want to keep it under that line or at that line at our healthcare capacity so that everybody can get the health treatment that they need and this disease doesn't have to take any more lives. So the CDC recommends, obviously, to self-isolate, to stay home, stay away from people. They have lowered gatherings. I think it's down to 5 people now, or your immediate family. They want you to stay 6 feet away from anybody else. They only want you to go out for groceries, for emergency medical help, or if you are considered essential personnel. So that means your job, you have to be there. It's essential for the community. Some other recommendations to help spread is to clean your hands often. Wash your hands good, wash it often, wash with good soap. Again, avoid close contact. They want you to clean and disinfect frequently, touch surfaces. And then again, self-isolate. Just stay home. Stay safe, stay healthy, stay home. That is what they recommend you do. Unfortunately, a lot of panic has ensued, and stores have been depleted of cleaning supplies and hand soap and all of that. So honestly, going to the stores can be less helpful, especially trying to self-isolate and keep your distance from people. Rushing to the stores probably isn't the best option. So again, just stay home, listen to CDC, wait for the quarantine and shelter in place to pass so that everybody can stay healthy, everybody can stay safe, and stay home.